So today I was hearing about how major drugs companies such as Merck, AstraZeneca, Novartis have all announced pulling out of their UK expansion, with their bosses warning that UK patients would lose access to cutting edge treatments. And the reasons are complex, to do with America's push for home investment and so far unsuccessful lobbying of the NHS to approve paying more to the drugs companies for our medicines. And all this made me want to put together some thoughts to share. So I wondered, is this our Cuba moment? What I mean by this is when Cuba struggled to obtain drugs due to the US trade embargo and then ultimately because of the collapse of their last trading partner, the Soviet Union, they turned to Chinese medicine because they'd long ago recognized the efficacy of the 19th century immigrant community's own doctors. So our situation obviously might not be quite as extreme as that, but it certainly feels like time to encourage a wider range of treatment options in our modern healthcare system. And the NHS Fit for the Future plan calls for this too. And it details, obviously, a historic crisis marked by deteriorating national health, a crisis in chronic disease, mental health, our ageing population, record low public satisfaction, escalating waiting lists, systemic pressures on its core services, and financial unsustainability. And Lord Darcy's review of the NHS for the government, which informed this plan, suggested that we must embrace new multidisciplinary levels of care. So British Acupuncture Council CEO Alex Jacobs pointed out that traditional acupuncture delivered by Professional Standards Authority accredited members offers a powerful medication-free existing solution to many of those critical issues that the plan highlighted. And our members, he said, are already working within NHS settings, helping to ease the pressure. And with an appropriate level of integration and support, we could do so much more. Now, just before I go on, for those who don't know me, I am an acupuncturist. I've been teaching acupuncture for nearly 20 years, but I'm also a researcher. And I've got an MSc in Health Services Research from York University and experience in running randomized controlled trials. And I'm not anti-drug. I had major life-saving surgery in 2023. That couldn't have happened. I wouldn't be here today without drugs. And I see my own patients benefit from life-saving and life-supporting drugs week in, week out. So for sure, difficulty accessing medicines like that poses a definite risk. And that is something we should be worried about. But most drugs don't come into that category. And even if we weren't at risk of reduced access to medicines, it shouldn't be forgotten that medicines themselves pose a significant risk. In fact, some are life-threatening. Adverse events from medication are estimated to account for 8.5% of all hospital admissions. So if you worked in an office with 100 people, all of whom had to go to hospital for some reason, 8 or 9 of them would be going for reasons directly related to their medicines. And in the over 65 age group, this statistic rises to 20%, so 1 in 5 of hospital admissions. Now, in comparison, in the largest acupuncture safety study, out of 4,441,103 acupuncture treatments, the number of reported serious adverse events was, guess what? 11. Now, that's 0.00025% of serious adverse events in all those acupuncture treatments. So, an independent review, the National Overprescribing Review Report, which carried out for the government in 2021, warned that overprescribing of medicines must stop because of these potential harms. It actually found that 10% of drugs, so 10 million items roughly in primary care, are, I quote, inappropriate, unnecessary, and could do harm, including premature death. And the report also noted the particular dangers associated with polypharmacy when people are on multiple medications, and then interaction effects between those medications are kind of layered onto the individual drug side effects. And it's noted that around 15% of people at that time were taking 5 or more medicines a day. Some of those, of course, are being taken to deal with side effects of the others. So overprescribing can happen when a better alternative's available but isn't given, or the medicine's appropriate for a condition but not the individual patient, or when a condition changes and the medicine's no longer appropriate, or the patient no longer needs the medicine, but they continue to be prescribed it. So, NHS England published a framework for action with integrated care boards, like the commissioning bodies, and primary care. And it was aimed at people on medicines associated with dependence or withdrawal symptoms. And it suggested offering alternative interventions and services where appropriate to patients when their prescription is being considered for a medicine associated with dependence and withdrawal symptoms. So that was commonly antidepressants, benzodiazepines, and gabapentinoids, for example. Or it might be offering alternative interventions when people on those medications are being reviewed. So how can acupuncture provide a solution? Well, for starters, we've got some great evidence in the area of depression. And most recently, in 2024, a large systematic review of depression as a standalone therapy compared to conventional drug therapy such as antidepressants concluded that acupuncture, when compared to conventional pharmacotherapy, exhibits significant efficacy as a standalone treatment after 4 weeks of intervention with fewer side effects and adverse reactions. With regards to benzodiazepines and gabapentinoids, 2021 NICE guidance for primary chronic pain specifically says that those drugs, along with corticosteroid injections, non-steroidal anti-inflammatory drugs, opioids, paracetamol, and others, should not be initiated to manage chronic primary pain. And if a person with chronic primary pain is already taking those medications, the guidance suggests healthcare professionals should explain the lack of evidence for these medicines for chronic primary pain and encourage and support them to reduce and stop that medication where possible. And that same that NICE guidance for chronic primary pain says that a course of acupuncture, however, should be considered based on the overwhelming positive evidence for acupuncture for chronic primary pain. So not only can acupuncture provide a safe, evidence-based, conventionally endorsed and recommended solution for many patients who should be considered for deprescribing of medications, like that specifically that I've just discussed, acupuncture also now has an enormous body of evidence across numerous conditions and areas of health that many people don't realise. Since the 1990s, acupuncture research has been increasing at around twice the rate of research into conventional biomedicine. So this growing body of positive evidence has resulted in numerous clinical guidelines recommending acupuncture worldwide. A study in 2018 identified 96 health problems for which positive conclusions in systematic reviews and meta-analysis regarding the effectiveness of acupuncture have been made. 2,189 positive recommendations were found for the use of acupuncture. Of these, over 1,400 were related to 107 different pain indications, and 703 were related to 97 non-pain indications, so a huge range of things. And these guidelines were from across the world, but were especially abundant in North America, Europe, and Australasia. So we are not talking here about a fringe, untested therapy. And also, it's really important to understand that traditional acupuncture is a complex intervention for many reasons. It's aimed at improving functioning across our body systems rather than being solely targeted at individual symptoms. Now, of course, research is carried out into specific conditions. And whilst the evidence is still clearly overwhelmingly positive in that respect, it can give you this false impression that acupuncture should be used just like a drug to target one symptom or disorder. But actually, the effects that acupuncture has on a person's whole system have been widely studied. And early evidence you may have heard of was around this gate control theory, just to do with pain and nerve fibres. But since then, evidence has emerged around so many effects on the nervous system, the endocrine system, cardiovascular system, muscles, connective tissue. Back in 2016, the neural mechanisms involved in the anti-inflammatory and anti-analgesic properties of acupuncture needling were uncovered, and that was around the effect on the vagus nerve pathway. And the vagus nerve is really essential for health. So it connects the brain to major organs. It enables communication that regulates critical functions like heart rate, digestion, the immune response. It plays a key role in the brain-gut axis, influencing mood and the body's ability to manage stress and inflammation. So a healthy vagal tone promotes the rest and digest state, fostering physical and mental well-being and resilience. And evidence is also emerging to suggest acupuncture may positively affect heart rate variability. Now, interestingly, in addition, acupuncture has also been shown to directly initiate a process called purinergic signaling. And that's a primitive and ubiquitous system in the body that affects regulation in all our tissues and organ systems. And it plays a central role in diverse clinical areas such as migraines and headaches, for which we're also in the NICE guidance, by the way, immune system dysfunction, inflammation, cancer, autism, Alzheimer's, cardiovascular disease, endocrine function, and embryological development. Now, this doesn't mean, of course, acupuncture can cure all the problems related to those areas. Of course not, but it does demonstrate that acupuncture has the potential to affect our whole physiology positively. And it does start to provide an explanation for why acupuncture has been shown to be clinically effective across such a wide range of conditions. And it might also go some way to explaining why acupuncture can play a role potentially in the prevention of disease, a central pillar in the NHS Fitness to the Future plan. So this is an area in which really exciting evidence is emerging. So in 2021, it was found in a long-term cohort study that acupuncture was associated with a decreased risk of dementia in patients with depression. In the same year, acupuncture was shown to decrease the risk of coronary heart disease in patients with osteoarthritis. In 2023, it was found that acupuncture was effective at reducing the risk of stroke in patients with migraines, with 19 years of follow-up. In 2024, acupuncture treatment was found to be associated with a decreased risk of dementia in patients with rheumatoid arthritis. And then in 2025, acupuncture showed a lowered stroke risk in insomnia patients. More sessions led to greater reductions. And also insomnia patients with comorbidities like diabetes and hypertension saw reduced stroke risk with acupuncture. So interestingly, the NHS Fit for the Future plan that I've mentioned also calls for a focus on prevention. Now let's go back to the issues with medications. We were talking about overprescribing. So now the overprescribing, for example, of antibiotics has contributed to the problem of drug resistance. Now, the magnitude of that problem, drug resistance, is now accepted, and it's been said that it will dwarf COVID. A major review on antimicrobial resistance estimated that by 2050, 10 million lives a year and a cumulative, wait for it, $100 trillion of economic output are at risk due to the rise of drug-resistant infections if we don't find proactive solutions now to slow down the rise of drug resistance. So those proactive solutions can and should include alternative ways of treating infections and infectious diseases. Now, again, we can't claim that acupuncture or indeed Chinese herbal medicine, for example, could provide the whole answer. But it does have a lot of interesting relative evidence and history of use in infections and infectious and acute diseases, and it does hold a lot of potential. Now, just one example in 2023, and this was a large review of 19 randomized controlled trials comprising over 1,700 patients. And that revealed that acupuncture was more effective than antibiotics in the treatment of acute pharynx throat infections. Now, the secondary results reveal the differences in the reduction of pain scores, sore throat duration, and white blood cell counts were statistically significant in the acupuncture group compared with the antibiotic group. Moreover, the acupuncture treatment resulted in a lower incidence of adverse events than the antibiotic treatment. Surprise. Now, my colleague Merlin Young, head of the charity Mox Africa, has been researching for a long time the use of moxibustion, that's a herb used topically on acupuncture points, a common acupuncture adjunct, in the field of drug-resistant tuberculosis. And in 2020, he presented data suggesting it can be helpful in developing countries in reducing infectivity in TB cases, including those co-infected with HIV, as well as significantly enhancing recovery in multi-drug resistant TB cases and even preventing the emergence of multi-drug resistant TB from latent infection. So those are just a couple of examples of many in the field, and I'm just using them to illustrate that we need to shift our thinking in the current climate. And aside from the very real problems that I've talked about so far, of risk of harm to individuals, risk of increased drug resistance, it's also important to be aware that the evidence of efficacy or effectiveness of medications overall is actually quite low. So a recent study identified the 21 most commonly prescribed drugs in England, France, and the United States. And those drugs covered 56 health indications and 114 related outcomes. So that overall evidence of efficacy was found for fewer than half of those indications. And besides that level of evidence, clinical meaningfulness is an important question, which relies on the nature of the endpoint, but also the effect size. So the study authors of this study I mentioned that was looking at the 21 most commonly prescribed drugs, so they cited recent meta-research conducted on a random selection of Cochrane systematic reviews. And that had identified very low rates of clinically meaningful efficacy. For example, a 2021 study in clinical pharmacology examined 400 reviews comparing interventions to a placebo or no intervention, and it assessed the proportion of reviews showing efficacy on a patient-important outcome with a high quality of evidence. And this was assessed with a widely developed and accepted grading scale of quality. And they found an efficacy rate of 8%. And they also cited a similar 2022 study, and this looked at a random sample of nearly 2,500 Cochrane reviews. Now, that revealed only 5.6% of eligible interventions that showed a benefit with high quality evidence. So, of course, the authors pointed out that those kind of rates are lower than they obtained in their own study, which found that, there was almost half of the commonly prescribed drugs had evidence for at least one indication. But of course, there's differences in methodology and nuances here. So they were focusing on the most commonly prescribed drugs. So as they say, you might expect a positive relationship between drug use and the level of evidence because those drugs have gained popularity, and maybe that's because they've proved efficacy in practice. And they use kind of lower, less stringent tools to evaluate the quality of the studies as well. And they also used a single robust study as sufficient evidence in their conclusion. So they concluded, although high quality studies supporting the benefit of medications are indeed often lacking, the absence of available evidence doesn't necessarily indicate a lack of efficacy. So they say they might even argue that low risk of bias trials or high quality trials are mostly needed when the effect size is small and not very observable. So the absence of robust data might then reflect empirically proven efficacy, so efficacy in practice, in use. Now, considering modern pharmacology has existed in something akin to its current form for under 200 years, I think the empirically proven efficacy over at least 10 times longer than that of acupuncture and Chinese medicine is nothing to be sniffed at either. It's no wonder that the World Health Organization points out acupuncture as the most common form of traditional medicine practice in 113 countries. So if you're still with me, and well done if you are, I want to just zone in quickly now on what my students know is one of my particular bugbears, and that's the widespread prescription of proton pump inhibitors, PPIs, such as lansoprazole and omeprazole. Now, these drugs were among the 21 most commonly prescribed drugs in the UK, the United States and France in the study that I've just talked about. So, the NHS guidance on these drugs explains if you take one of them for more than 3 months because of a reduced ability to absorb vitamins and minerals, the levels of magnesium in your blood may fall. Now, low magnesium can make you feel tired, confused, and dizzy, cause muscle twitches, restless legs, shakiness, even an irregular heartbeat. So, taking lansoprazole for more than a year or omeprazole may increase your chances of side effects such as gut infections, bone fractures, and vitamin B12 deficiency, again, due to an inability to absorb it so well. Now, if you're B12 deficient, that can lead to pernicious anemia. You can feel very, very fatigued. Other symptoms might include a sore or quite red tongue, mouth ulcers, pins and needles, but it can actually range right through to psychological problems, and that might be mild depression or anxiety, but right through to confusion and dementia. So if you take one of these drugs for longer than a year, the NHS guidance says your doctor will regularly check your health to see if you should carry on taking it. Now, I'm not disrespecting busy doctors here, but does this happen regularly? Now, professionally trained acupuncturists have a high level of training in red flag symptoms of possible disease requiring conventional referral. And they're also trained to pick up issues that might be arising from medications, again, requiring conventional referral for a review. At the Acupuncture Academy in Leamington Spa, where I'm joint principal, we carried out research over nearly 10 years collecting referral data from our clinical year acupuncture interns, and we found that at least 14% of patients overall had been referred by our acupuncture interns for further medical evaluation. Almost half of our students made at least one referral during their clinical intern year. And these referrals often led to life-changing medical interventions, and they included early detection of cancer, diagnosis of hemochromatosis, identification in many examples of untreated hypertension, as well as conditions such as thyroid disorders, diabetes, and significant vitamin and mineral deficiencies, including those arising from medication use, such as long-term proton pump inhibitors. In fact, over 30% of our referrals were made for medication reviews overall, including picking up concerning interactions in patients on multiple drugs or polypharmacy patients. So it is not simply that our acupuncture treatment is safe in itself. Acupuncturists can play an important role in helping to identify when patients do need conventional care or review in situations of potential harm that might otherwise have been missed, therefore decreasing the overall risk of harm. So I'll conclude by saying for sure, I know I've presented a very positive view of acupuncture here, and of course it's not the answer to all of society's ills. Not all our evidence is positive, just like any intervention, and we still lack evidence in some areas. As I say, so do medicines. But equally, acupuncture as a whole systems medicine has only tested specific acupuncture interventions in specific conditions, and as a complex intervention, applying research models designed for single medications is problematic. But despite this, we've seen there's a large and ever-growing positive body of clinical evidence across a huge range of conditions, as well as evidence of positive and systemic effects on our physiology overall. It's so exciting. And it's undoubtedly a treatment that's relatively safe. It's safe for children who are often prescribed off-label drugs because medicines tend not to be tested in children. And it's also safe for the elderly and other vulnerable patient groups. And there is much evidence also of cost effectiveness with long-term effects showing after a course of treatment's finished, and even those preventive effects over a long period of time emerging, as I've talked about. So I'm saying again, British Acupuncture Council members under the Professional Standards Authority, which also oversees statutory regulators such as the General Medical Council, our members are already helping to ease the pressure and provide an evidence-based, safe and effective solution. And with this appropriate level that we're calling for of integration and support, we can do so much more and reach patients who couldn't otherwise access this incredible treatment option. So I encourage you all, write to your MP, talk to your GP, ask for acupuncture and shout these messages from the rooftops. Because as access to drugs and drug resistance become real problems today, we can provide part of the solution. Thanks for listening.